Imagine a medical career where you profoundly impact lives, but not within the operating room. You are a detective, a counselor, a long-term partner in health. What does that day truly look like? The daily routine of a non-surgical medical specialty is incredibly diverse, but it often centers on patient consultations, diagnostic interpretation, medication management, and collaborative care. Instead of performing procedures, these doctors spend their days assessing symptoms, ordering tests, making diagnoses, and developing treatment plans tailored to each individual. This variability stems from several key factors. First, the specific specialty plays a huge role. For instance, a dermatologist might see 30 patients in a clinic day, performing quick skin checks and minor office procedures, while a neurologist could spend hours with a single patient, conducting detailed physical examinations and interpreting complex imaging. A psychiatrist's day often involves talk therapy and medication management, requiring deep listening and nuanced interaction. Then consider the practice setting. A hospitalist working in an inpatient setting might start their day rounding on patients, reviewing laboratory results, and coordinating with nurses and consultants. Whereas a family medicine physician in an outpatient clinic focuses on scheduled appointments, preventative care, and managing chronic conditions. Academic physicians balance patient care with teaching medical students and residents, and dedicating time to research. The level of patient acuity also shapes the day. Managing a stable chronic illness in an outpatient setting is vastly different from stabilizing a critically ill patient in an intensive care unit, even if both are non-surgical roles. Furthermore, subspecialization within a field, like a gastroenterologist versus a general internist, brings its own set of unique challenges and daily tasks, often incorporating specialized diagnostic tests such as endoscopies. Finally, administrative duties such as paperwork, charting, and committee meetings are an inevitable part of any physician's day, influencing scheduling and time management. On-call schedules, where physicians provide remote or in-person coverage for emergencies, further add to the dynamic nature of these roles. To truly understand what a non-surgical specialty's daily routine might look like for you, direct experience is invaluable. Shadowing physicians in different non-surgical fields will give you a first-hand look at their typical day, from patient interactions to charting time. Talking to residents and attending physicians about their work-life balance, their favorite and least favorite aspects of their jobs, and how their routine has evolved can provide critical insights. Actively participating in various electives during your medical school rotations is essential. This allows you to immerse yourself in the environment and see if the pace and type of work align with your personal preferences and strengths. Consider what kind of patient relationships you value, how much diagnostic detective work you enjoy, and your comfort level with different levels of patient acuity. What many find deeply rewarding in non-surgical specialties is the role of being a true diagnostic detective. You are often piecing together subtle clues from a patient's history, physical exam, and laboratory results to solve complex medical puzzles. This intellectual challenge is coupled with the immense privilege of forming longitudinal patient relationships, often guiding individuals through years of health and illness. The ability to witness the direct impact of your treatment decisions and build that trust over time is incredibly fulfilling. Non-surgical fields also increasingly relying on interdisciplinary team collaboration, working closely with nurses, pharmacists, physical therapists, and other specialists to provide holistic care. This team-based approach ensures comprehensive support for the patient and enriches the daily professional experience. Ultimately, the seemingly varied daily routine in non-surgical medicine is not a drawback, but an invitation. It is an opportunity to explore a broad spectrum of patient care and find a path that deeply resonates with your skills, interests, and desired lifestyle. By understanding the diverse factors that shape these routines and proactively seeking immersive experiences, you can confidently navigate your medical training to discover the non-surgical specialty where you will thrive, building a career that is both challenging and profoundly rewarding.